My name is Izabela Horzempa. I'm a dermatology PA. I practice in Trumbull, Connecticut at Integrated Dermatology. I am co-chairing the PANP360 Immersive Conference, and I'm also a board member of the Early Career Committee with the SCPA. So that's a great question. We created the PANP 360 Immersive Conference because we wanted to have a CME experience where it's a short 1 day kind of event. And at this point, NPs and PAs can attend these events and learn the latest and greatest, the new upcoming treatment, um, how to treat difficult cases and inflammatory conditions. And this conference is going to be very heavy on joint discussion between the attendees and the speakers. The whole point of this conference is that PAs and NPs can come in to Philly for the day, spend the time in lecture listening and actually learning the high yield facts. And then they can go either stay the night and enjoy Philly that night, or they can actually just drive home. Co-chairing for the immersive conference has definitely been exciting and very eye-opening, because as clinicians, we attend these conferences and then we see the final product. But being involved with the planning process really shows how much thought goes into each session and picking out the speaker and picking out what the learning objective for our attendees are going to be. One of the most exciting parts of planning this conference has been working with my co-chairs, Henry Yu and Jill Cohen, and they are just as passionate about education as I am. So it was nice to collaborate with them and build something that's very interactive, practical, and very useful for our everyday dermatology practice. So attendees can definitely expect a blend of lectures and small group sessions with hands-on workshops. We will be having specific workshops on HS and the hard to treat patients, for example, patients who are pregnant, patients with inflammatory bowel disease, and or cardiovascular problems. We're also going to have Dr. Amy Spazocco from New York City come in and give a lecture on trichoscopy. And last but not least, we're going to have Dr. Michael Payette from Connecticut come in and speak about the mode of action for our psoriatic drugs. And I'll be leading the interactive case discussions for the hidradenitis suppurativa. So if you're coming to the conference, I'm excited to connect with you during that. So there's definitely going to be a lot of pearls you could take back on Monday morning because we are going to have 15 tips under 15 minutes. So all the faculty members are going to come in and give you tips on clinical management in addition to just clinical pearls. But the one thing that I hope every clinician can start using immediately on Monday morning is optimizing therapy before escalating. So what that means is, for example, when a patient is on a biologic therapy, let's say either for psoriasis or eczema or prurigo nodularis or any of the ones we currently have, before switching them to a new medication, we can really, if they're not well controlled with the previous biologic, we could think about how long have they been on this medication for, because it's so easy to switch to a new medication since we have now a plethora of these biologics. We really want to give it a chance, make sure that we're keeping our patients on these biologics for as long as the data shows, making sure that the medications aren't being missed, any troubleshooting any barriers that the patient has. One thing I want to mention is that this conference will give up to five CME Category 1 credits, which can be very hard for PAs and NPs to obtain. And this conference lets you have that all while, bringing in all these new pearls back on Monday morning to your clinic. My advice is always to say yes to opportunities that align with your passions and your goals. Programs like the SDPA Emerging Scholar, these kinds of programs give you mentorship, the opportunity to network, and they give you exposure to leadership. So, stepping into like an educational or a leadership role allows you to share your clinical expertise and help shape the next generation of dermatology PAs and NPs. For me, I think this opportunity was very great, and I definitely am very happy that I said yes. Being involved in co-chairing a conference like this really helps to balance out my career. And it shows me that I can have a hands-on day-to-day experience with patients who give me a unique perspective that I can use to, educate and improve clinical practice and then also inspire the next generation of APPs.